Good morning. My name is Amy Montgomery. I'm a nurse practitioner at Turnpaugh Health and Wellness, and today I would like to talk to you a little bit about cardiovascular disease. Cardiovascular disease is the number one killer in the United States right now for both men and women. One person every 36 seconds dies from cardiovascular disease. Now, cardiovascular disease primarily refers to patients who suffer from heart attacks and stroke. It has to do with the blood flow to those organs. So for hearts, we look at the coronary arteries. And for the brain, we look at carotid and vertebral arteries primarily, providing most of the blood flow there. So if there is a blockage in those arteries, usually from plaque buildup, then you have a narrowing and a stiffening of the arteries and you have a loss of blood flow to those areas. The other thing that could potentially happen is the plaque can break off and completely occlude blood flow to one of those areas. And that's when we see patients complaining of crushing chest pain, shortness of breath, or stroke-like symptoms, and that is true emergency. So, unfortunately, I am very familiar with these types of patients because I worked most of my career in the hospital and I would see these patients come in on a regular basis. So today I would like to just talk to you about some of the risk factors associated with that and how we can really help you to optimize your health. So, primary risk factors. One of them is diet. We're going to get into a little bit more detail about what are the right foods to get or to eat. I know there's some confusion as to what is actually heart healthy, along with things like smoking, high blood pressure, high cholesterol, obesity, diabetes, and of course, genetics plays a role as well. Everything but genetics is really a modifiable risk factor. So I'd like to dig into those a little bit for you to provide information for you. So let's take it back to 1958. There was a gentleman by the name of Ansel Keys. He did what was called the 7 countries studies because he had a hypothesis that fat in the diet caused coronary artery disease and heart attacks. And so he picked 7 countries that he was going to do his study on, and he claimed to find a correlation between fat in the diet and heart disease. Unfortunately, we have picked apart his study that he did, and there were a lot of design flaws. And unfortunately, the information might not be all that credible. First of all, there were other factors at that time that could have definitely contributed to an increased risk of heart disease, one of them being smoking. Smoking was very popular at that time. Another thing that was on the rise was the production of grains and the consumptions of grains and excess sugar in the diet. Additionally, he didn't include some countries that had a high-fat diet, such as France. They had a high-fat diet. They were also very healthy and had low rates of cardiovascular disease. But because he found a correlation because of the countries that he looked at, he was able to convince the health officials and the American Heart Association that indeed there was a correlation between fat in the diet and cardiovascular disease. So they started to send the message out to the Americans that it's best to follow a low-fat diet. The food industry jumped on board, started taking fat out of the food that they were producing. And when you take fat out of the food generally tastes very poor, so they added sugar to make it taste better. And then in the 1970s and 1980s, there was this huge push, low-fat everything for all Americans. And by the 1980s, we really started to see an increase in the obesity levels. We also saw an increase in type 2 diabetes, and cardiovascular disease was on the rise. So this may not have been the golden ticket. And even today, when we look at the population of Americans, we continue to get sicker and sicker. Approximately 30% of the American population is obese, and in some states the rate is over 35%. Cardiovascular disease, still the number one killer, we already discussed that. And diabetes, approximately 1 in 2 people is either pre-diabetic or diabetic. So we're in a very sad state right now, and it's very obvious that what we're doing is not working. So there have been many researchers over the past years that have tried to look at studies and do their own research in clinical trials, and they really haven't been able to find a direct causation between saturated fat and heart disease or cardiovascular disease. The American Heart Association in 2015 dropped their guidelines to limit cholesterol in the diet. They also dropped the guideline to put a cap on fat. However, they do specifically still recommend a low saturated fat diet. They also recommend vegetable oils. Vegetable oils are definitely known to cause inflammation in the diet and are definitely not considered heart healthy when you look at the research. The best type of oil to use is olive oil. It's known for many positive effects, anti-inflammatory effects, and it is widely used in the Mediterranean diet. The Mediterranean diet has been very well studied and is found to be beneficial with patients who have cardiovascular disease and also metabolic syndrome, those suffering with diabetes, high blood pressure, weight gain, all of that. So, the interesting thing about the Mediterranean diet is it not only uses olive oil, but it uses other healthy fats such as nuts and avocados and fatty fish, all which are really beneficial. They help to create anti-inflammatory effects on the body, and they are high in omega-3s. There's been profound impact for patients who follow the Mediterranean diet. Now, it's not for everybody, certainly, because some people have issues with certain types of foods such as eggs and dairy, which are common for people to have food intolerances. So it might not be the right diet for that person. Other patients tend to find really good effect with the ketogenic diet. Now, this is a very difficult diet to follow because you are basically extremely restricting the amount of carbohydrates that you're putting in your diet, and you're eating a lot of fat and a lot of vegetables. And I'd like to emphasize that when we do a ketogenic diet, we are really eating very clean and putting high quality meats into our body and not really following what was known as the Atkins diet. So I have seen both benefit from the ketogenic diet. A lot of people lose a lot of weight, and they also drop their cholesterol numbers. But I've also seen it go the other way, where people have a rise in their cholesterol numbers with the ketogenic diet. So that's not for everybody either. A lot of patients that we have do a paleo or an anti-inflammatory diet have good success for that as well. So I think the bottom line with diet is one diet is not going to fit every single person. We really have to evaluate each individual person and determine what is best for each individual person. Another thing that I would like to bring to your attention is cholesterol. Cholesterol is a risk factor for cardiovascular disease, but unfortunately, most providers are looking at a standard lipid panel these days. So when you go to the doctor, they're really only looking at total cholesterol, HDL, which is the good cholesterol, LDL, which is considered bad cholesterol, and triglycerides. But what we know from the past several years of research is that it's more important to really look at the bad cholesterol and not just the total weight of that cholesterol, which is on a standard lipid panel, but what size are those cholesterol molecules? Because we know that the smaller those molecules are, the more dangerous they are, the more sticky they are, and the more likely they are to cause plaque buildup on the artery walls. I'm going to show you a picture of what I use, a diagram I use for my patients. So you can see there are 4 different patients there, and Maria has tiny little particles, and she's got a lot of them. She is much more at risk for developing atherosclerosis or plaque buildup on her artery walls than the person in the green area there, Jerry, who has much bigger molecules. Now, all these people have the same LDL when you look at a standard lipid profile, but as you can see, the actual size of the molecule is much, much different. So you can have a normal LDL by weight, but then you do an advanced lipid profile like this and look at those cholesterol molecules and find that they may be just as high risk because they have much smaller molecules. Or you can have a high LDL, what might be out of normal range, but have really big molecule sizes. So they're not as at risk for developing plaque buildup on the artery walls. The other thing that we like to look at is things that signify inflammation in the body, such as C-reactive protein, homocysteine, We evaluate an insulin level and a blood sugar level. This information gives us a ton of evidence of whether or not, the person is metabolically healthy, and really it gives us a better understanding if they are truly at risk for cardiovascular disease. And of course, blood pressure is a big problem as well. A lot of people have high blood pressure, and high blood pressure causes turbulence in the blood vessels, which then increase your risk for dislodging a piece of plaque, and that dislodged plaque can cause a complete occlusion of blood flow to either the brain or the heart. So, as I've discussed the many risk factors that are associated with cardiovascular disease, and I think the bottom line is each person should be individually looked at. We need to assess lifestyle, exercise, habits, inflammatory markers. You should have an advanced lipid profile and really have a good overall assessment of your particular needs. And at Turnpaugh Health and Wellness, that's exactly what we do. We're looking at the underlying root cause for a lot of different problems, including cardiovascular disease. So I highly recommend that you have a practitioner evaluate you before it's too late, and also, hopefully, before you have to be put on a prescription medication. Now, prescription medications, I'm not totally against, but I think they are overprescribed, especially statin medications, because they do have their own side effect profile. So please come see one of us so that we can help you. All right, I hope you have a good day. Thank you so much for listening.